So welcome to this week's video. We are talking about scalp psoriasis. We're going to talk about scalp psoriasis treatment and scalp psoriasis removal. So at the end of this week's video, you're going to become a bit of a scalp psoriasis pro. So welcome to my channel. If you haven't been here before, we talk about everything medical and healthcare here on the channel. All of the information that we give is always supported and backed up by scientific evidence, so you know you can trust the information that we're going to give you. Also, with every single video, we always do chapter in the description below, so if there's any relevant information that you want to find, feel free to click on the description below, click on the relevant bit that is relevant to you and go straight to it. However, as I would always say, please make sure to watch the whole video because there's so much to learn. Also, before we begin, please don't forget, if you find anything helpful in today's video, if you think to yourself, you know what, I learned something new today, that was really interesting, please don't forget to click that like button because it's going to help me and it's going to help the video grow. Now let's begin. So first of all, what is psoriasis? Psoriasis is a long-term skin condition where the skin becomes red, it can sometimes become crusty, it can become flaky, it can become inflamed, and sometimes that crusty thickened skin can have a silver scaly appearance as well. When we say scalp psoriasis, this is obviously just on the scalp, so it's psoriasis of the scalp. And please remember, psoriasis has got nothing to do with hygiene, so it doesn't mean that you're unhygienic, it doesn't mean that you can pass it on to someone, you can't catch it from someone. It's just an unfortunate skin condition that some people get. Now, in terms of what causes psoriasis, it's actually caused by an abnormal skin production cycle. So in normal individuals, it usually takes about 3 to 4 weeks for the skin cycle to kind of recycle. In terms of psoriasis, we're talking 3 to 7 days. So hence why you get that build-up and thickening of the skin, and then you get that scaly appearance as well as a result of it. Now, when it comes to psoriasis, it's one of these conditions that we don't actually know what is causing it. It's a condition that we call an autoimmune condition. This is where we believe that the immune system is causing this to occur. Now, what's causing that in the first place is still to be discovered, but it's what we call an autoimmune condition, so the immune system is attacking itself and causing this to happen. And please do remember that psoriasis can generally happen anywhere on the body, but it's more prominent on the elbows, on the knees, sometimes it can be on the lower back. However, this video we are just specifically focusing on scalp psoriasis, which can be particularly troublesome for a lot of people out there. So I really do hope that you find this information helpful. Now, with psoriasis, sometimes it can disappear on its own, it can come back on its own as well. Sometimes we can have what you call a flare-up, so the skin condition is becoming a lot more aggressive. So for example, if you've got scalp psoriasis and it's becoming more aggressive, it's becoming more itchy, it's becoming more flaky and thicker, sometimes that's often known as a flare-up. Sometimes when we're having a flare-up as well of scalp psoriasis, we can experience hair loss as well because the optimum environment for the actual hair follicles isn't there. Sometimes the hair will fall. Generally speaking, the hair does grow back once we get the psoriasis under control as well. Now, before we begin with scalp psoriasis treatments, I just want to go through a few general points of advice that anyone can do with psoriasis. First of all, stress has been linked to making psoriasis worse, so please think about it. If you're doing something, you know, in work and your life that's really stressful that you can particularly avoid that's causing it, that can actually help with the psoriasis as well and the symptoms that you're having. So really think about the stress and, you know, having coping mechanisms as well that could help with it to help reduce your stress levels. Also, if you smoke as well, smoking can make psoriasis worse, so quitting smoking can also be really helpful with psoriasis. These are just general things that we can all do, as well as having a healthy, balanced diet. These are all things that will potentially help with psoriasis. Now, with all these three things, I do have videos on how to quit smoking, so if you want more information on it, it's going to be up here for you. I also have more information on eating a healthy, balanced diet and what you need to do. Again, it's going to be up here. And lastly, like I said, if you do stress as well, I have quite a few videos on different stress and relaxation techniques that you might find helpful. And again, I'm going to leave it up here. They're all going to be in the description below for you as well. Now, alcohol has also been linked to potentially making psoriasis worse. So please have a look at how much alcohol you're having. If you're having more than the recommended amount of alcohol per week, you need to try and cut down. I will leave a calculator in the description below that you can use to calculate how many units of alcohol you're having. It will give you some advice as well if you're having too much and what you need to do. So please do check that out as well. And lastly, before we move on to psoriasis treatment, obesity has also been linked to making psoriasis worse and causing more flare-ups. So please, again, have a look at your BMI. Again, I'm gonna leave a link in the description below. I'm sorry I'm leaving so many links, but I just wanted to give this quick bit of general advice before we move on to the treatments. I will leave a link in the description where you can calculate your BMI. If you are overweight and you actually want to lose some weight, I do have quite a few videos on this topic already, which have had over 20-30 million views that have helped a lot of people looking at scientific ways to actually reduce, you know, your weight and how you can do it the healthy way. So if you want more information on that, again, I'm gonna leave it up here and in the description below. I'm sorry I've done so many links right now, but I just really wanted to give that that general piece of advice right at the beginning so you can actually make some changes if you think to yourself, actually I can make these few changes as well that are going to help with my psoriasis. Now let's begin with some treatments. Now in terms of scalp psoriasis treatments, there are a range of different things that we can try. There are also some over-the-counter options that you can buy here in the UK. I'm not sure about other parts of the world and the regulations are different, but there are treatments that you can buy here in the UK. So these treatments fall into 3 different categories. So first of all, we're talking topical treatments. So we're talking ointments, lotions, creams, that sort of stuff that you apply topically to the area. The next sort of treatment that we're talking is phototherapy. This is where UV light is used to help with the psoriasis. And also we have systemic treatment, which is obviously like through a capsule or a tablet. So we're having medicine orally to help with the symptoms. So in terms of topical treatment, I am going to go into exactly how we apply topical treatments in some detail eventually. But now let's go through each topical treatment and learn a bit more about them. Now the first kind of topical treatment that we're talking about is going to be a moisturizer, okay? So moisturizers can be used on the scalp. It depends which moisturizer as well, so you will need to speak to a healthcare professional about that. But these can be really helpful at helping to lock in the moisture on the scalp, especially when a scalp is damaged. It's really good to put some moisturizer on it, rub it in deep into the scalp to help retain that moisture and stop water from coming from the scalp and losing it and making it really dry. This can be really helpful. Also, some other topical treatments actually work better when the scalp is moisturized rather than it being very dry. So again, it can be very helpful for that. If you are using other topical treatments, okay, so you're going to use a moisturizer plus other topical treatments, it's best to wait at least 30 minutes before applying the next topical treatment. Now, the next topical treatment I'd like to discuss is steroids. Steroids can be really helpful at reducing the inflammation and reducing that rapid turnover of skin cells that we spoke about earlier. Please remember though, steroids can cause thinning of the skin, so please be aware of that. Also, generally speaking, it's recommended that you don't use a topical steroid for more than 2 months. However, this can be different in terms of if your healthcare professional is advising you to use it for longer, that's completely fine. As long as they're monitoring you, there is an issue. But please remember that steroid overuse as well can sometimes be a big issue, especially if your healthcare professional isn't sort of involved in this process and you're just doing it on your own back. So always involve your healthcare professional, let them know what you're doing so they can be aware how long you're using the steroid and when to taper down and what to do. This is one of the most important things that you need to remember with steroids. Now, the next topical medicine that I'd like to discuss are coal tar preparations. Again, these can be quite helpful with psoriasis when you've got real thickening of the scalp, so real scaling going on, and the coal tar can help break down that scaling, break down that flakiness, okay, and break down the sort of dead skin that's on top. The only thing about coal tar that you remember is one, it can quite excessively dry the scalp, so that's also important to remember, and it can leave a really foul smell, okay? They're not the most pleasant things to use, but be aware of it. They're usually used with other topical treatments as well that your healthcare professional would advise you on. Now, moving on to another topical medicine that are often prescribed for scalp psoriasis are vitamin D and vitamin D analogs, okay? These aren't tablets that you take, these are also ointments or lotions that you use on the scalp. They can be quite helpful at reducing the inflammation and reducing that turnover of the skin cells that we spoke about earlier with psoriasis. Sometimes you can get vitamin D analogs and a steroid in combination. These are quite often prescribed as well and actually quite helpful as well. So again, this is another form of treatment to make you aware of. And the final topical medicine that I want to make you aware of is calcineurin inhibitors. These are often prescribed by specialists. They're not usually the first line treatment that we go for. They reduce the inflammation and they reduce the immune system that's causing, so a topical area, so it's reducing the immune system in that area that might be causing the psoriasis. Again, it's not the first line treatment, so this has just been a bit of an overview of different topical treatments that we have available for psoriasis. Okay, so now that we've got the basics about scalp psoriasis treatments, the topical treatments that are available, now let's talk about applications. So how do we apply these topical applications to get the most out of it? Because this is probably one of the most critical parts that not a lot of people speak about, so a lot of people aren't aware of what to do. They're just thinking, oh, I'll just put this in my hair and that's it. But there's actually a few things that you can do that are really going to help them be even more effective. So let's begin. Okay, so first of all, if your scalp has some really thick scales on it, okay, so we've got some thick crusting on top of your scalp. Remember, this is just going to mean if this is your scalp, for example, and you've got this thick layer on top of it that's like that, and that's your actual initial scalp, when you're putting your topical preparation on it, it's not going to go down to that bottom area that we want it to go to. It's just going to get stuck there. So it's a bit of a waste of medication. So what we need to do is try and reduce that thickening, that scaling. So we need to try and get rid of it. So one way, like we said about the moisturizers at the start, is to apply a moisturizer to the scalp. So for example, you can use olive oil, you can use coconut oil. Coconut oil I find patients really find helpful because it doesn't leave that greasy residue that olive oil does, and some people use emulsifying ointment as well on their scalp. Okay, so you really need to rub it into your scalp. It's not about rubbing it into your hair. That's really not going to make much of a difference. You really need to get it rubbed into your scalp. Be gentle, okay? And generally speaking, if you can, put a shower cap on or something like that and leave it on overnight, okay? The longer you leave it on, the better it's going to be at helping with that thickening of the psoriasis, okay? That thickening on top of the scalp. So once you've left it on, the next day, go for a shower, okay, and wash it off using your medicated shampoo or any other shampoo that your healthcare professional has recommended you to use. So wash it off, gently really rubbing inside the scalp to try and get it off and to clear the scalp as much as possible. This is just going to get rid of that thickening. It's going to get rid of those layers eventually, okay? Some people find that combing through actually can help dislodge some of these scales as well, which can do as well, and it's a good idea, but you need to be gentle. You don't really want to be going harsh, and you don't want to be picking at them as well with your finger, because this might cause more damage than good. So you just need to gently do it and slowly give it time, okay? It's not going to be a one-time thing and it's going to get rid of it all completely, I promise you. You need to give it time, you need to be patient, and eventually these scales and the thickening will reduce. Okay, so once you've done all that, let's say next you need to apply some medicated topical lotion on or something like that, okay? It can be any of the options that we've discussed because we've gone through how they work and what they do. So whichever option that your healthcare professional has prescribed you and recommended to you, you're gonna apply that. Now the first thing that I would highly recommend everyone does is to get some kind of band or something to put across their forehead, okay? This is gonna be really important because it's inevitable that when you put some scalp lotion on or whatever, it's gonna drip down, okay? And sometimes these can be quite potent steroids, and potent means like strong steroids basically. We don't want it to really go on our face because our skin on our face is so thin, and eventually if you're doing it every day, let's say for a month or 2 months, and it's dripping down, it will cause damage to your skin, and you don't want that. So the first thing that I'd highly recommend is everyone buys some kind of hairband or something that you can just wear across the head, and obviously change it every couple of days because I'm sure it will get stuff on it, or just keep washing it and cleaning it after you've used it. So that's the first thing. Next thing you need to do is really sort of think about parting the hair slowly into different sections and applying the lotion. I sometimes recommend to patients as well to wear a glove. I find that medical gloves can be really helpful for this, especially again, you're using topical steroids, it's gonna cause damage to your fingers and your skin as well. The scalp is a different type of texture of the skin compared to your hands and face and the parts of your body. So I would wear medicated gloves or just some gloves that you can just dispose of, okay? That can be really helpful. So partitioning it and going into sections using the recommended amount that's been directed in the information leaflet and really patting it in, okay? So when you're applying it afterwards, patting it in gently with your fingers and sort of pressing it in and kind of massaging the scalp slowly just for it to really get into the scalp and really be effective. That is the best way that I can recommend in terms of using the treatments, topical treatments. Obviously follow the instructions, okay? But if you're finding it to be too greasy, if you're finding the topical, the topical products to be too greasy and too sticky, speak to your healthcare professional, okay? There are loads of different options available in terms of topical treatments for psoriasis, and it can prescribe you different types of lotions which might work better for you, and you might find them more easy to apply, because that's one of the main things when you've got scalp psoriasis. It can be difficult to apply, especially if you've got thick hair, and sometimes you might feel like, when I'm applying it, I'm losing hair, and it's kind of like a negative feedback because you then don't want to apply it because your then hair's going to fall out. But trust me, if we do get the psoriasis under control, the hair does, generally speaking, usually grow back. So I really hope this information helps you. So now that we spoke about the topical treatments and how to use them, I just want to go through some general tips now as well. Make sure that you're brushing your hair, okay? Like I said earlier as well, when you feel like your hair's falling out, you don't really want to brush your hair as much because you feel like it's all going to fall out. But brushing the hair can also help stimulate hair growth as well. But it's also going to help with the psoriasis and get rid of the flakes and the thickening, okay? So it's important that we still brush our hair. Now, sometimes scalp psoriasis can become visible, and I know it can affect some people's confidence and self-esteem, and it's normal, okay? But please remember, I don't think anyone looks at it and is going to judge you for it, so please don't let it get to you. But it's definitely a good idea to maybe speak to your hairdresser or your barber to think of some ideas maybe to cover it as well, some different cuts that they can do to be a bit creative and maybe cover it if it is affecting your, your self-esteem and your confidence and you're feeling a little embarrassed about it. But please don't. But if you are, there are them sort of options to think about as well. Now, I know we spoke about vitamin D medicines in terms of topical treatments and the vitamin D analogs, topical ones, but also there has been some great research shown that taking vitamin D as well, especially being vitamin D deficient, okay, can increase firstly our hair loss. It can also cause us to have worse skin, okay. It can cause flare-ups, it can cause eczema, it can cause dry skin. So I'd highly recommend that if you do have psoriasis, definitely look at getting a vitamin D supplement, okay? It doesn't have to be a massive dose. Speak to your healthcare professional for what they recommend to you. You can buy them over the counter. They're relatively inexpensive these days, vitamin D, but it's definitely a good idea because there's been a lot of research supporting vitamin D, and we've seen a lot of research showing that actual low vitamin D is seen in a lot of patients who've got eczema, psoriasis, skin conditions, these kinds of things. So it's definitely a good idea to get supplemented with one. And as with all the medical products, please remember to read the information leaflet that comes with it, read the instructions that come with it, speak to your healthcare professional, make sure that you're safe and suitable to use it, and ask them questions on how to use it as well. Your healthcare professionals are there to help, and I know it can sometimes be a bit confusing and complicated how to use these products, okay? Because I've seen loads of patients who really struggle to apply them, and because it's difficult to do it, sometimes you just don't do it anymore. So speak to your healthcare professional, let them know how you feel, let them know what's working for you, and let them know what's not working for you. That's what they're there for. They are there to help you. I promise you they will not be upset. You're not taking their time, that's what they're there for. Okay, so we've come to the end of this week's video. I really do hope that you found this information helpful. It's been a bit of a tricky video for me to kind of structure and put into place, but we went through the different treatment options that are available. I really did focus more on the topical treatments because I think that's the main thing that people struggle with. The other sort of treatments are easy to use, but it's more the topical ones that are difficult to apply and knowing what to do with them. So I really do hope that you find this information helpful. If you have any of your own tips as well, please leave some comments below because I would love to read it, and I'm sure everyone else watching this video would love to as well. If you've found a certain product to work well for you, if you've found a certain technique to work well for you, leave a comment below. Again, I'm telling you, people will be interested to learn more as well. As I always say at the end of every single week's video, please always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.